All right, let's dive right in. Today, we're going to be demystifying a global health threat that literally puts billions of people at risk: dengue fever. We're going to break down what it is, exactly how it spreads, and what makes it so incredibly dangerous.
So to really get a handle on dengue, you have to understand the sheer scale of the problem. Just look at this number. Over 2.5 billion people around the world are at risk of getting infected. There's almost a third of the entire human population living under the threat of this one virus.
And this isn't just some abstract risk. Every single year, a staggering number of people actually get sick. Somewhere between 40 and 80 million people are infected with the dengue virus.
And the really tragic part? For a lot of those people, the infection proves fatal. We're talking about 25,000 deaths every single year. So this is without a doubt a major global threat that we really need to pay attention to.
Okay, so what exactly is the culprit behind these massive numbers? Let's get formally introduced to the dengue virus itself. And as you'll see, it's more like a family of fevers.
So here's one of the things that makes dengue so tricky. It's not just one single virus. It's actually a group of 5 distinct versions, or what scientists call serotypes. Now, getting infected with one of these doesn't protect you from the others. In fact, and this is the scary part, if you get a second infection from a different serotype, it's often way more severe. You can see why this is a massive headache for developing a single effective vaccine.
And where does this virus like to hang out? Well, its main hosts are primates, which, that includes us humans. We are a primary reservoir for the virus, which is what helps keep it circulating in our communities.
So, what does it actually feel like to get dengue? Let's walk through the clinical journey, which, as we'll see, can escalate really quickly from a bad fever to a life-threatening shock.
A typical case of dengue usually kicks off like a really severe flu. The symptoms are just awful: a brutal headache, a high fever, a rash, and these deep, agonizing pains in your bones, muscles, and joints. The pain is so legendary, in fact, that dengue has earned the nickname breakbone fever.
Now, what's really fascinating and frankly terrifying about dengue is how it can progress. It can move through 3 very distinct stages. It starts as dengue fever, but in some cases it can get much worse, turning into dengue hemorrhagic fever, where you start to see bleeding. And from there, it can become dengue shock syndrome, which is basically a catastrophic failure of your entire circulatory system.
But wait, how does this virus get from one person to another? It can't just jump through the air. It needs a helper, an accomplice, if you will. So let's talk about the mosquito connection.
The virus can't pass directly from me to you. It needs a middleman, a very specific one, the Aedes mosquito. So when one of these mosquitoes bites an infected person, it picks up the virus. Then it basically becomes a tiny flying syringe, passing the virus on to the next person it bites.
And this is what makes controlling dengue an absolute nightmare. See, once a mosquito gets infected, it's infected for its entire life. But it gets even worse. The female mosquito can pass the virus directly down to her offspring through her eggs. This process is called trans-ovarian transmission, and it creates this vicious, self-perpetuating cycle where whole generations of mosquitoes are born already carrying the virus.
We know that the severe stages of dengue can be deadly, but what is actually happening inside a person's body to cause all this? Let's take a look at the core problem.
So this is really the critical question for doctors and patients alike, right? What is it inside the body that flips that switch? What causes that dangerous shift from a bad fever to the hemorrhagic and shock syndromes?
Well, the simplest way to put it is this: the body's entire plumbing system starts to fail. The central problem, the thing that causes all the trouble, is leaky blood vessels. The scientific term for this is an acute increase in vascular permeability. But really all that means is that the walls of your blood vessels, which are supposed to be like solid pipes, suddenly become porous. They start acting like a sieve. This lets plasma, that's the liquid part of your blood, leak out into your tissues, which causes a huge, dangerous drop in blood pressure.
And because the real problem is this internal leaking, there's no magic pill or antiviral drug that can cure dengue. The only thing doctors can do is provide supportive care. They're essentially in a race against time, constantly trying to pump the patient full of fluids, replacing the lost plasma and electrolytes to stop their whole circulatory system from collapsing.
So all of this brings us back to the fundamental challenge, this massive question in the fight against dengue. If the mosquito that carries the virus is infected for its entire life and can even pass that infection on to its children, how on earth do we ever truly break the cycle?